Hello, and thank you so much for the opportunity to speak with you today. My name is Jessica Nicole Suarez, and I'm incredibly excited to apply for the RN position here at ABC Hospital. The opportunity feels like a natural next step in the journey that's been over a decade in the making, a journey rooted in compassion, resilience, and a genuine love for patient care. I am currently a licensed vocational nurse with a strong background in diverse healthcare settings. I worked in skilled nursing facilities, provided care in school settings for children with physical and mental disabilities, and currently work in hospice care, a field that has deepened my empathy and reinforced my passion for being present in people's most vulnerable moments. As an LVN, I cared for over 40 patients at a time, managing medication passes, collaborating with physicians, and even assisting in code blue situations alongside my team. These high pressure experiences have strengthened my ability to stay calm, think critically, and respond effectively under stress, skills that are crucial for any RN. During my time as a school nurse, I supported students with complex needs, including those with G tubes, cerebral palsy, and students who face language barriers. This role taught me patience, adaptability, and how to communicate in ways that are meaningful even when words are limited. Before becoming a nurse, I also worked as an activities assistant, which gave me the unique opportunity to connect with patients on a personal level. While nurses and CNAs were very busy with their own clinical responsibilities, I was able to step in and provide emotional engagement, whether it was through games, conversations, or just holding someone's hand. That experience helped me shape how I approach care holistically, not just treating conditions, but treating people. Later, when I transitioned into admissions, I became the first point of contact for new patients and their families. I learned the importance of first impressions, clear communication, and setting the tone for a compassionate, welcoming environment. I also gained a deeper understanding of the continuum of care and how vital it is for every department to work together to give patients the best possible experience. Now, to be completely honest, I didn't always want to be a nurse. In fact, I tried to run the opposite direction. Nursing runs deep in my family. My mom's a nurse, her sisters are nurses, my grandmother was a private caregiver, but I didn't see myself in that role at first until life had other plans. When my grandmother was diagnosed with pancreatic cancer, I accompanied her to her chemo appointments. Sitting in those waiting rooms, watching the nurses interact with such grace, skill, and empathy, it changed something in me. I began to see the power of nursing not just as a profession, but as a calling. That seed was planted, and then later, when I had my own children who faced their own health challenges, I knew I needed to step into the role of not only being their advocate, but also someone who could truly understand and support others going through difficult medical journeys. That's when I embraced nursing fully, and I haven't looked back since. Some of the challenges I see in nursing, especially in my current role, includes understaffing, burnout, and the overwhelming pressure of balancing patient care with administrative demands. I've seen how the political side of healthcare can complicate things, but despite all that, I remain grounded in my purpose to care, to advocate, and to be a consistent, dependable presence for my patients and the team. In fact, when I was in LVN school, I was voted most dependable, and I carry that recognition with pride because I believe it speaks to my worth ethic. I'm team oriented, and I genuinely care for others. Whether it's family, friends, colleagues, or patients, people know they can rely on me. If you ask others to describe me, you'd probably hear words like caring, respectful, responsible, and a team player. And I think those qualities are exactly what makes a strong nurse, not just clinical skills, but also human connection. Some key skills, though, that I can bring to the RN role includes time management. I juggle priorities effectively and ensure tasks are done with attention to detail and urgency. I'm strong in communication. I ask clarifying questions, share updates across the team, and make sure everyone's on the same page. And I have empathy. I always try to see things through the patient's eyes. I understand that when someone is in pain, when they're frustrated or scared, it's my job to meet them with patience and compassion, not judgment. Whether the patient is crying, confused, screaming, I'm committed to staying grounded, professional, and supportive because that's when they need us the most. If given the opportunity to join the team at ABC Hospital, I would be honored to contribute to your mission of providing excellent care and bring my full heart and experience to the role. But before we wrap up, I do have a few questions that I would like to ask. How does the hospital typically handle conflict in the workplace? What kind of benefits such as medical, dental, and PTO are offered to nursing staff? As well as what is the staff turnover rate among nurses, and how is staff supported, especially when it comes to call-offs or short staffing? Thank you again for your time and consideration. I would truly love the chance to be a part of the ABC Hospital team and continue growing as a compassionate, committed registered nurse.